These great human themes of freedom and creativity and anxiety and alienation and death and what's the meaning of it all. And when people show up for therapy, like some of that is what's lurking underneath it all, right? We can talk about how to approach symptoms, but I mean, the main symptom is the human condition. And how do we find our way to a meaningful, loving life?
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arno, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area. All right, Dave, good morning. Friday morning. We're back to recording. Skipped last week, but here we are. Funny enough, I miss the days when we don't record.
Same here. It feels like a little something is missing. So who would have thought a year down the road we'd be kind of missing this regular part of our routine now?
Yeah. And speaking of who would have thought, we are sitting here with Dr. Bill Whelton. And who would have thought after so many years of leaving the University of Alberta, leaving Edmonton, I would be in contact again with Dr. Whelton, with Bill, and here we are sitting. I know the listeners can't see us, but I'm grinning ear to ear. It's so nice to see Bill again, and he's our guest today.
Yeah, when we locked this up after our intro or our conversation about doing this, I was bouncing around the office. I was telling everyone who knows Bill that we got him coming on the podcast, and I can't wait to reconnect with him. It's been years, but definitely a positive impact. And I'll share a little bit more of that, I think, in a minute here after. Maybe let's introduce Bill to the listeners more formally.
Absolutely. And if you were in a graduate program in psychology at the U of A at the University of Alberta, you know Dr. Bill Whelton. So Dr. Bill Whelton grew up in a big family in Ottawa. Both his parents were originally from farms in New Brunswick, so there was always something of a maritime vibe to their home. Bill has lived in a number of places across Canada, including Ottawa, Halifax, Kingston, Ontario, Toronto, Regina, and Edmonton. He did all of his studies in clinical psychology at York University in Toronto, where he was supervised by the famed scholar and researcher Dr. Les Greenberg, the principal creator of emotion-focused therapy. Bill graduated with a PhD in 2001. After a short stint in the psychology department at the University of Regina, he has spent the last 25 years as a professor in the counseling psychology program in the Faculty of Education at the University of Alberta in Edmonton. One of the reasons he was hired was that the program had been recently accredited by the Canadian Psychological Association and needed someone to teach a required doctoral level course in the history and systems of psychology, which Bill has done for many years now. This challenging course has been much appreciated by many students. And another area of strength and expertise has been psychotherapy, especially process and outcome research. Bill has particular expertise and interest in emotion-focused therapy and relational gestalt therapy, and has particularly enjoyed supervising grad student therapy. So welcome, Dr. Bill Whelton.
Oh, it's my pleasure. Great to be with you.
Before you speak too much, Bill, I'm going to jump in because I have to. I mean, thinking back to my grad study days, and I think so what we started in '09, and the first year has a lot of the coursework. So we would have probably taken your course in '09. And as a student, we would all sit back after the lecture and be amazed at your intellect, how much information you could recall. And you could lecture without looking at any notes, the names, the dates, so a lot of us were quite intimidated and quite amazed at this, what we were privy to. So I don't know if I remember exactly too much about the history content as much as the way it was taught and the storytelling, right? So there was the intellect and the storytelling, and we would be captivated. And it was a very interesting course that we probably looking at the syllabus did not anticipate it being that lively and interesting just because of history. At times, history is not always, interesting without the context and the stories. And I think that's what you did to bring it alive. And then I also need to say, after that course, so I probably Bill has been one of the most influential, or at least touched most of the main elements of my training at the U of A for my PhD. So Bill was one of my clinical supervisors during my internship. So I got to, get to know Bill from a supervision perspective and from a clinical psychology perspective in terms of practice and applied psychology. And what really stood out for me, and I have a couple of examples where Bill would be quite protective, caring, empathetic. Like, so here was this respected lecturer, intellect, and I was quite intimidated and a bit unsure of how supervision would go. And it was probably, the first supervision session where I felt comfortable, I felt supported, I felt encouraged. So those are just like, again, not always the details, but like the felt sense of what being around Bill was like. And then the last one was my PhD dissertation defense panel, and Bill participated in that too, and didn't fail me. So I got to complete my degree, which was not always a certainty. So it's been great. It's really kind of a treat to reconnect after all these years and to hear more about kind of what you're doing now, and to learn again, just as a refresher of some element of the history of psychology.
And
Okay, that's it for me. Yeah.
I'm gonna raise my hand too. I don't have as much of an arc as Dave does with Bill, but I remember, and my anecdote is that, I finished my undergrad at Western. I actually took a senior year course in the history of psychology. I thought it was interesting. And when I came to the U of A, I think because that first year is so busy, to be very honest, I don't think I've told anybody this. I tried to get out of the history of psychology course because I was like, well, I've taken one already. Why do I have to take it again? And, the department didn't let me. And so I had to take the course. But I must say, I am so glad that I did not bail out of that course because Bill made it so interesting. And to what Dave said, it was storytelling. And it wasn't a lecture, it was storytelling. And through that, learned so much about where psychology came from. It wasn't just Freud, and pop culture. That's what most people think of psychology. But it came, years and years before Freud, going back to philosophy. And this is what I really remember about the course is that it was thoroughly enjoyed. I remember it being at like 9 in the morning, maybe a little earlier, but people woke up for that course, and it was great to just sit there. It was a great way to start our days. And given Bill's demeanor, so calm, I remember all the practice therapy that we would be doing in our classes, and Bill would sit there patiently, probably thinking, what are these guys doing? Like, this is the future of our profession. But so patient, and his guidance was amazing in those practice therapy sessions.
So Bill, now you get a chance to say a little.
Yeah, no, I think, part of me says, like maybe we should just stop the podcast now after that. I mean, it kind of blows me away. I'm very, very gratified to see two students from our program doing so well. Like it's just, you're talking about the future of the profession. It is awesome to see the future of the profession in such good hands. And even if I had a little bit a little tiny bit to play with that, a part to play in that, to me, that's just what gives pleasure to being a prof, right? To being a teacher. Yeah, you're mentioning the history course, and I've always really enjoyed teaching the history course in our program in the Faculty of Education at the University of Alberta. It's been a fun course to develop and a fun course to teach. I always felt confident that I had enough background because I came out of the York program, and one of the immense strengths of the program at York was their history and theory section. Like every big department, it had a number of different areas. And one of the areas was history and theory. And I was taught by Kurt Danziger, I was taught by Ray Fancher, I was taught by David Bakken, Christopher, I'm blocking on his last name, but Christopher, who's there now, one of the leaders, Thomas Teo. And of course, one of my fellow students was Alex Rutherford, who's gone on to be Christopher Green. Christopher Green. And Alex Rutherford, she's gone on to be a tremendous historian of psychology herself, right? So I just felt like I was coming out of all of that, and I knew a fair bit about it. But my own approach, and I'm gonna, get into it, with today's subject. My own approach has been very personal, idiosyncratic. I don't just focus on the history of the discipline. I mean, there is a discipline, and it's a very clear, circumscribed discipline going back to the 1870s. But like it didn't start from nothing. Like it starts from ideas that have percolated for centuries and for millennia, really, about what the human person is. What does it mean to be a human being, right? And what are the great themes of human life? And what does it mean to be good, to be bad? What does it mean to be fulfilled or unfulfilled? And all of those types of things, right? And so, I was influenced in that quite a bit by Ray Fancher and his book Pioneers of Psychology, because he
Hmm.
starts with René Descartes and John Locke and so on. But I've enjoyed going back even further than that, right? And I've also picked some slightly different people, and some of what I focus on is not particularly discussed in most courses. But I mean, as far as I'm concerned, with these big issues of being human, literature has as much to say as psychology does, has tremendously influenced psychology, religion, mythology,
Hmm.
philosophy, all of these things kind of are tributaries that feed into psychology, right?
It's really interesting, Bill, because when Dave and I started this podcast, we were thinking like there's going to be so many different topics we can talk about because psychology is infused in every facet of life. And I think what you just said there, whether it's religion, whether it's philosophy, you talk about Locke and Descartes, these are not individuals that you typically associate with psychology, but it dates back all the way back where they were interested in human behaviors.
Oh yeah, absolutely. Yeah. And they had pictures of what it is, like how, the great rationalist tradition that comes out of Descartes, like how does that impact some psychologists and not others? Or empiricism that comes out of Locke, how does that impact people? And I think, the topic that I was invited to chat a bit about today is humanistic psychotherapies. And humanistic psychotherapies, I'll just begin by saying it's like a family of psychotherapies. And traditionally in psychotherapy research, there are others, but there are three big families of psychotherapies. The cognitive behavioral family, which has, 20 different things that belong to it, but it's a cluster, right? Then psychoanalytic and psychodynamic therapy, also a big cluster with many different groups within it. And humanistic psychotherapy is one of the great families of psychotherapy, including Gestalt, emotion focus, person centered, existential, all of these all belong to this group, right? And yeah, no, I mean what I talk about in like I say, this is a little bit idiosyncratic, but I think it's also completely true. What I talk about is how if we go all the way back to about 1750,
Hmm.
the development of the Romantic movement, I think humanistic psychotherapies owe a great deal to Romanticism and to the Romantic movement, which developed in England, in Germany, well, especially England and Germany, but then it spread to France, to Italy, all through Europe, really. It was a movement that existed in music, in literature, in painting, and all of that. But one of the progenitors of it was a guy named Jean-Jacques Rousseau. And I think Jean-Jacques Rousseau is an important figure in understanding humanistic psychotherapy. I think the first time I ever read Carl Rogers, I remember thinking to myself, well, this is Jean-Jacques Rousseau, right? And I mean, I wasn't the only person who thought that because he was often asked, well, were you influenced by Jean-Jacques Rousseau? And he always denied it, which, I take him at face value, but I mean, it's very similar stuff. And Jean-Jacques Rousseau began with the idea, and I'm going to be, just for the sake of time, I'll be kind of really brief. But he began with the idea like, well, human beings are good. Like in the state of nature, which is a bit of an abstraction, but in the state of nature, people are good. They're naturally good and virtuous and all of that. And he says, but but what is it then that corrupts them? What gets in the way of human beings being everything they can be? And he said they're corrupted by social relationships. In the run of society, the hierarchy of society, people, I'm being very simplistic here, but people become people pleasers and they grovel to the mighty and they sell themselves out in order to be accepted, to be liked and affirmed and all of that. Yeah, and I think that had a lot of influence, that idea, on the Romantic movement and eventually on Carl Rogers and other humanistic psychotherapists, right? Carl Rogers said, people are good, but conditions of worth that develop in the family corrupt children, right? They have to please their parents in order to be liked, loved, protected, and they do it by being what the parents want them to be. But in that process, they can run into all kinds of problems where they're not attending to their true feelings, their true self, and that can lead to becoming alienated, depressed, and so on later on in life, right? So, what is the Romantic movement? I mean, I'm going to be really brief here, but I mean, it's a reaction to the Enlightenment and to rationalism and science and all of what that connotes, right? And I mean, the Romantics said, no, what's really important in life is feeling and emotion. What's really important is not the great and the mighty, but they were very democratic, the normal, ordinary person. What's really important is creativity, spontaneous self-expression, and all of these things that have become very much part of our culture, right?
Yeah.
And especially with social media and so on.
Sorry, Bill, I'm going to just throw a little question in because
Sure.
I'm trying to make sense of this in my head. Would you say, so if it's interpersonal or social relationships that corrupt the goodness in people, but this romantic
According to Rousseau, yeah, yeah.
yeah, but this romantic movement was like a movement away from, say, duty or obligation, that side of the interpersonal, that if you follow your passion with love or connection or desire, that was a good kind of like social relationship to move towards at this time?
That's absolutely correct. But in if you want, in the broadest possible terms, the self became the center of life.
Hmm.
I mean, that had been happening ever since the Renaissance and the Reformation. There had been much more emphasis on the individual and the individuals. The Reformation was each person before God. You didn't need priests. It was you before God. That was the Protestant tradition. And then, of course, with René Descartes, there's also a turn inward towards subjectivity, toward the self. That's what grounds me. I think, therefore I am, right? But it's me thinking, right? This whole emphasis on individualism and the self just profoundly deepens with the Romantics. And it has continued to deepen ever since then, right? And there's good and bad to it, but I mean, it definitely is a key river flowing into humanistic psychotherapy. And so it's my sense of self, it's exploring my inward being, it's going deep within myself, the artist, in the romantic idea, the artist has to go within him or herself, struggle with my demons. And I mean, all that turmoil gets expressed outward into my art. Right. And so I'm not trying to, in the famous phrase of Abrams, I'm not trying to be a mirror holding, I'm not, as an artist, I'm not, showing the world as it is. I'm showing myself as I am. And that's the source of good art. And if you want to see it in music, just compare Mozart to Beethoven. Beethoven was very romantic, right? I mean, Mozart would not have created something like the Fifth Symphony, right? I mean, that's very romantic, right?
Yeah, Beethoven's music was like his inner struggle, like the
Yes,
storm clouds and
yes,
and then the
yes,
peacefulness, but the storm clouds return and
yes,
yeah. Which
yeah,
I would say, Bill, as you're explaining and describing this, it's I guess in a way, is it very Eurocentric in the sense when we talk about
yeah,
the romanticism, right? Because I mean, when I think about other cultures, they might be thinking, that's very selfish. That's, why just think of yourself?
yeah.
So would you say that this is a very Eurocentric type of concept?
Yes, absolutely.
Yeah.
Yeah. No, I mean, if you're looking at the whole world and ideas growing out of India or China or, I mean, it's very different traditions, right?
Yeah.
And but this is the European kind of the great European tradition, so it's absolutely Eurocentric, absolutely. And the whole focus on the individual is Eurocentric, but it didn't happen overnight, is the story, right? I mean, it really began at the time. I mean, you could, I could make a whole argument that it began as far back as Saint Augustine, right? And yeah, there is a like very good body of literature that has developed on how Christianity as a religion ultimately had the seeds that became this focus on the individual, right?
Mm.
But it certainly really took strength with the Reformation and the Renaissance. And I think, reached its kind of well, it's reaching its peak today, probably. But I mean, it really reached an intellectual peak with the Romantics that and I mean, just for the sake of time, I would skip then to the early existentialists were very influenced by the Romantics, people like Schopenhauer, people like Kierkegaard, people like Nietzsche. They really were the progenitors of existentialism, and existentialism is kind of in many ways an outgrowth of Romanticism, right? And it's also very focused on major themes of human life, but for the individual, it's an inherently, I mean, to the great, some of the great existentialists, people like Sartre, Heidegger, whatever, would say, it's like defining who you are over and against the herd, right? I mean, like the crowd or the herd was viewed as, conforming to the herd is not a good kind of existential move to make in their view, right? You can dispute that, right? And it is, we are talking about, North American and European culture, right?
Yeah.
And that whole focus, right? And it has its limitations, which we can get into eventually too. But yeah, no, the existentialists, I think, very strongly influenced a whole stream of humanistic psychotherapy. And but one of the bridge figures that not nobody, I shouldn't say nobody, but that not is not talked about, but I think is worth talking about, is a guy who was a disciple of Freud's named Otto Rank. And Rank ended up breaking away from Freud and developing his own school of thought. To some degree, he developed his own school of thought. I mean, Rank doesn't have followers in the same way that Adler or Jung have followers, right? But the a really two little stories about Rank. I mean, one was that Carl Rogers in the 1930s had been trained, and most many of the humanistic psychotherapists, many of the cognitive behavioral therapists were trained as psychodynamic or psychoanalytic therapists, right? And grew very unhappy with it, right?
Hmm.
I mean, the founder of behavior therapy was a guy named Joseph Wolpe, who grew to despise psychoanalytic therapy, right? And I think Rogers was very unhappy with it. And at some crucial point in the late 1930s, he spent a weekend at a workshop given by Otto Rank. And he admitted later on that this changed his life, that it changed his whole way of thinking about therapy and what therapy is for and how to do it. And the particular thing that Rank emphasized, I mean, you had Kendall Bannock on this podcast, and she was talking about emotion focused therapy. Well, what Rank emphasized was feeling, was emotion and
Hmm.
feeling, and the importance of emotion and feeling in defining your sense of subjectivity of yourself and of like what you had to attend to develop as a human person, the importance of emotion. And I mean, he had something that he called will therapy, but it's about creating a self. So yeah, no, he really influenced Carl Rogers. Carl Rogers' emphasis on feelings and emotions, he said, like, one of my main influences was Otto Rank. Another thing that Otto Rank talked a great deal about, and I think you guys have been reading a novel where this comes into play, and was death. I mean, the breach between Rank and Freud was that Rank developed a whole theory of the impact of the trauma of birth on the person. You don't need to buy into the theory, but the conclusion he came to was that we are impacted by birth trauma. And we're safe and cozy in the womb, and suddenly we're thrust out into the world, and it's hard. And I mean, he had this whole idea that separating from the mother and the whole process of individuation and becoming a person, an individual, is a very difficult process that begins with a trauma, which is the trauma of birth. And that part of that is that as an individual, we become aware that we're fallible, that we're frail, that we're going to die. So death rears its head, right? And one of the great books about Otto Rank was by a guy named Ernest Becker. And he wrote a book called The Denial of Death that came out, oddly enough, he died himself, and it came out posthumously. He had written it just before he died of cancer at a fairly young age, and it won a Pulitzer. But The Denial of Death was rooted in the thinking of Otto Rank and has had a tremendous influence on psychology, which we could talk about later if you wanted to. But yeah, no, Rank was this bridge figure, I think, between a lot of the romanticism that came through the 19th century existentialists, and death becomes a major theme in existential psychotherapy. And you've been
Yeah.
reading Yalom. I mean, tell me a little bit about your thoughts about Yalom.
I was just gonna say, Bill, I love how you painted that arc of romanticism to
Mhm.
existentialism to where we are today. And I think I still work with clients who will present with existential crises,
Yeah,
right? This whole idea of what am I doing here,
yeah.
and thoughts of death. Not in a sense that, I'm gonna hurt myself or kill myself, but just this idea of existence.
No, yeah, listening, I was also had my own kind of, I was thinking about how history repeats itself and like breaking away from the herd. And so much of the things that we heard even during COVID or after COVID, and this also this individualism that a lot of focus now on narcissism and this, so we are revisiting these topics, I think as we're trying to figure out what does it mean to be a good human being, right, that never goes away. And so it's really interesting to hear the history And then going to Yalom. Yalom is such a, I mean, reminds me of you, Bill, but such a great storyteller and has written novels that have historical facts and really accurate kind of elements to them. So even though they're fiction, there's a lot of nonfiction and captivating in terms of posing these questions that I think as soon as we were not fighting for our food and shelter, that we started to ponder. And then that works its way into the therapy room. So maybe I'll leave it there. But I feel like these ideas, these fascinations, if we have a bit of time, our mind can easily go there and maybe even kind of hurt our brain a little bit, because thinking about death and what it means to be good is hard sometimes.
I think the reason I really like Yalom's writing, we've read Schopenhauer Cure, Dave and I are right now listening/reading When Nietzsche Wept, is that he takes these historical pieces and weaves them into his own expertise of being a psychiatrist and
Yeah.
understanding human behavior. So, if you've never read Yalom's work, the way he paints character arcs based on one's psychology and behavior is phenomenal.
Yes. Yeah, yeah. No, he's a very impressive individual, and he's one of these people that has done 20 times more than what a typical productive person does, right? But I mean, and we'll come back to some of those big issues. I mean, we'll come back to Rogers and a guy named Abraham Maslow, who were the two big early figures in humanistic psychotherapy, right? And a lot can be said about both of them. But I mean, to talk for a few minutes about Yalom, he's written novels. I mean, I think the two best are the Schopenhauer Cure and When Nietzsche Wept, the two that you've mentioned. He's also written books of case stories that are, quite interesting. But he has two big textbooks. And one textbook is on existential psychotherapy, super interesting. I mean, both of his textbooks are just well worth reading, right? And the other one is kind of an introduction to group psychotherapy. It's kind of considered the Bible of group psychotherapy, is Yalom's book, right?
Yeah.
But when he talks about group psychotherapy, and I mean, I'm going to link it to death, right? I mean, what he says is like he got really interested in death because he at some point early in his career, he started doing groups with terminally ill cancer patients and people who had been given a year to live, 2 years to live, maybe 3 or 4 years to live, but were terminally ill. And I mean, you can imagine in the 60s and 70s, available treatments for cancer were minimal, and a lot of people didn't survive having cancer. But he says what I kept hearing in the groups were people who were terminally ill telling me I didn't really start to live until I found out I was terminally ill. He said, like, people would tell him, like really, my life began when was given a death sentence by the doctor. And so Yalom was obviously really intrigued by this and trying to understand it and so on. But the gist of it is that they started living differently. They started making different choices. They started valuing different things. And I mean, we all know we're going to die. We all do at some level. Human beings know they're going to die, but we manage to find 100 ways to avoid it or defend against it, and so on and so forth. And there might be value in a lot of the time defending against it, but it doesn't break through enough. And then he was listening to these patients, and they were told, like, you have 2 years to live. And once they get over the shock of it, they live those 2 years in a very different way. And when he was exploring that with them, what they would typically say is, I care much less what people think of what I do. I care much less about whether or not I'm afraid of being judged by others. I don't spend or waste a lot of time doing things from a sense of obligation that I don't really want to do because I only have 2 years. I'm going to focus on the people I love, the things that are really important to me without worrying about what others think, right? I mean, I'm sure I'm simplifying, but that was the gist of what they were telling them. And yeah, going all the way back to Otto Rank, I mean, he said most of what we do in life is a response to our knowledge. I mean, indirectly, a response to our knowledge that we're going to die, right? Yeah.
So, as I'm hearing you talk about that, Bill, the word authenticity and genuineness comes up. For those 2 years, if you're told, how long you have left to live, you're gonna live your authentic self. You're gonna be as genuine as you can. I wonder though, and this is sort of the psychologist coming out here, is people afraid to be authentic and genuine because they're worried about what might actually come out from that, right? Like, are there going to be things that you may say or do that is out of what society expects, out of the ordinary, and is that scary? And so, we better defend against the authenticity. We better not let all of that out.
I mean that's a really interesting question, right? And it's a question that cuts against the grain of some of what humanistic psychotherapy is arguing, right? Because if you believe with Carl Rogers or with Jean-Jacques Rousseau that you're inherently good, well, then getting to your authentic self, getting to your true valuing process, what Rogers called the organismic valuing process, getting to that, getting to that deep self and letting it be expressed is going to be good, right? I mean, like you believe, like what's in there is going to be good, right? I mean, I think
Yeah.
there's a very strong argument to be made that maybe that may be an overly innocent and positive picture of human beings. And that really it's a more complicated, developing a personal conscience, it might involve repressing some instincts or, some authentic feelings, right? And it varies, right? It's a complicated question, right? What are we good? Are we bad? Or what are we some mixture of the two? And from an existential point of view, are we free to choose between being good or being bad? And what does
Yeah.
that, right? I mean,
It's
very
certainly, it's not black or white. But I think in the world that we live in today, with everything that's happening, it's a very relatable question.
yes. It's always a very important question. What does it mean to be a virtuous person, right? And also, how much can we be authentic and what exactly does that mean, right? And yeah, but I mean, I want to go back just for a minute to, I mean, the two in the 40s, the 50s, and the 60s. The two main psychologists involved in developing humanistic psychotherapy were Abraham Maslow and Carl Rogers. And, Yalom was on the sideline, various other people were involved. But I think, generally from a historical point of view, the two biggest influences on humanistic psychotherapy were Carl Rogers and Abraham Maslow. And this goes back to something you said, David, about like when your basic needs are met, larger questions kind of emerge. And that was, I mean, I'll say in a very general way, where Maslow and Rogers were very similar, where humanistic therapy was very similar, was a real family, was a very high degree of emphasis on human potential. Like that basically the Freudian school of thought in psychodynamic therapy, the behavioral school of thought, those were the two big emerging ones, that they were too reductionistic and that human beings have to be seen as a whole. And all of the potential we have to grow and to develop and to become and yeah, to become who we're capable of being, to be creative, to think, right? I mean, Abraham Maslow liked to, point towards great figures like Einstein, like basically, what do we have in us if we let it grow and develop? He says like we need, he has that famous pyramid of human needs, right? And he said like once we got our security needs, our food needs, all of our basic needs met, then we have a need for meaning. Then we have a need for growth, for creativity. We have a need to develop our potential. There's still a remnant of this in everything that talks about strengths-based counseling, right? I mean,
Mhm.
strengths-based counseling is very much a remnant of the human potential movement that came out of Maslow and Rogers, right? But that was Maslow's emphasis was transcendence. Talk about like self-actualizing, and then he's peak experiences, and then transcendent experiences. He wasn't actually he was himself he was an atheist, but he was a very deep believer in spirituality, and the idea that spirituality refers to real experiences human beings can have, right?
Mhm.
And so, yeah, no, I mean, I was tweaked to that in part by you saying, like, you start to think about these things when you're part of a society where you don't have to worry too much about just finding enough to eat, or, finding shelter, or when you can focus a little bit on your deep meanings, right?
I mean, that makes me think of just stereotypically, the person who's climbing the corporate ladder, right? And then they get the diagnosis of the terminal cancer, and how that kind of awakens them to possibly think about these things, right? That they've been so busy kind of what's next and moving up, and they don't even have time to ponder their own kind of mortality, right? And then it's front and center. And from there, then we can evolve. We can become who we are supposed to be, or who we genuinely or authentically are. And I think we see that in therapy rooms all the time, right? That if someone takes the time to enter a therapy room to actually look at themselves and to reflect, then this, what you're describing, can happen quite organically.
Yeah, no, I used to, in my psychotherapy courses, for a number of years, I used to assign a book by Tolstoy called The Death of Ivan Ilyich. And it's not even really a novel, it's just a novella. It's like a long short story. It's only about 70 or 80 pages long. And it's a masterpiece of world literature by one of the greatest writers who ever lived. And the death of Ivan Ilyich was exactly what you're describing, right? And I mean, I used to think this is going to help you as a therapist to kind of wrestle with this and see how Tolstoy wrestled with it. And but it's exactly what you just laid out, right? Ivan Ilyich is a bureaucrat. He's kind of a Russian bureaucrat who's kind of going along blindly, trying to get ahead, trying to advance in a material way, more money and a bigger house and a better job and all of that sort of thing, and then hurts himself. And it's about his resistance. Initially, it's about his resistance to even allowing himself to acknowledge that he's dying, that he's not going to get better from his injury, right? But if he resists, that's nothing compared to the way his family and the people around him resist. Like they don't want to think about it, they don't want to talk about it, they don't want to acknowledge it. And finally, there's a character named Gerasim, who's a peasant, and, I mean, you can, I mean, I won't go into it, but if you know Tolstoy, he was very influenced by Jean-Jacques Rousseau, right? And he kind of idealizes his peasants, right? But the peasant is the only person who will openly talk to Ivan Ilyich about, like, you're dying. He says it like you're dying, and helps him to face the fact that he's dying, and to go through the process, right? And to feel
Mhm.
accompanied by somebody in that process. And yeah, no, Yalom, he talks. You both know this, but I mean, Yalom says there are four great existential themes that emerge. And he said, like, this isn't a singular approach to therapy. These are themes that come up in all therapies. Like
Mhm.
whether you're CBT or dynamic, whatever you are, these are themes that you're going to hear all the time. And they're fundamentally existential themes. And the main one is death. Because he thinks that a lot of, and Otto Rank thought this too in a slightly different way, right? But he thinks a lot of what we do is finding ways to escape from an awareness of death. But I mean, Yalom's inclined to think that a lot of anxiety, I mean, you were saying, Andrew, that I mean, it comes up, death comes up in various ways in therapies. But what Yalom would say is that the main way it comes up with is people like really struggling with anxiety
Mhm.
because he thinks that a lot of other forms of anxiety underneath it all are expressions of death anxiety, right? Of our basic mortality, the fact that we know that we're frail, we're vulnerable, we're in a profound way, right? And, we can hide it from ourselves, but only up to a point, right?
Mhm.
Well, one of the
Mhm.
other books by Yalom is Staring at the Sun, and that one I've read a couple of times or listened to a couple of times, and it is very much if anyone is struggling with, an unknown anxiety or a potential death anxiety, like that book walks through a lot of that element of his existential approach.
Yeah, no, I mean, these great human themes. I mean, Yalom is one of the people who actually brings them into the discussion, right? Of freedom and creativity and anxiety and alienation and death and what's the meaning of it all. And like these are the great themes of human life, right? And you would just think like when people show up for therapy, like some of that is what's lurking underneath it all, right? We can talk about the technology of therapy and and how to approach symptoms and but I mean the main symptom is the human condition, right? And suffering and alienation and how do we find our way to a meaningful loving life?
This is such a good discussion, even as a reminder, as a therapist. We get so caught up sometimes in diagnostics,
Yeah.
right? Diagnostics equals treatment of some sort. You apply treatment, but I think going back to these themes that you were talking about, Bill, whether it's death, our limitations, or another theme is freedom, that Yalom talks about is freedom, or purposefulness, or I guess meaninglessness. These are all things that even in a therapy room, we may not talk about Yalom directly, but we certainly talk about purpose,
Yes.
right? We talk about what is your life about?
Yes. Yeah, yeah.
What's your identity? And
Yes.
all of these themes keep coming back up.
Yeah, who are you, right? And yeah, no, I mean I mean I'm probably loath at this stage to introduce new names, but I will briefly mention Jean-Paul Sartre, right? Who's a great French existential philosopher, right? And I mean his famous slogan was existence precedes essence. Existence precedes essence. And what he meant by that, roughly speaking, was for human beings, we're not like a dog or a tree or a brick, like a stone, not a brick, a stone. The who we are, first we're alive, first we exist, and then our essence, who we're going to be, we have some freedom and choice in becoming the person we want to be. Now there's a way of understanding that, and I'm not 100% sure exactly how Sartre understood it or how far he wanted to take it. He probably wanted to take it farther than I would, but in terms of like just how much we can shape our lives. because 99% of most people's lives is given, right? I mean, and there is a human nature, and we participate in it, and there's a lot of constraints to it. But I think that there was a fundamental truth to what he was trying to say, which is that human beings are unfinished. We're unfinished. A lot about us comes from our nature, our family, our biology, our culture. A lot of it comes from things that are beyond our control, but something always remains within our control. There's always the potential. That's why why I'm saying we're unfinished. Like there is a way in which we will freely choose to be, to some degree, the person that we choose to be freely. And we do have some creative kind of dimension in forming and shaping who we become as people, right? And this is the freedom. This was the other great theme, or one of the other. I mean, Yalom talked about death, then he talked about freedom and responsibility, and then he talked about meaning versus meaninglessness, and then he talked about isolation. That there's a sense in which we're born alone and die alone. I mean, in a particular way, he kind of like there are parts of what I'm feeling that I'm never able to communicate completely to any other person, right? There is a sense of isolation that everyone in their suffering kind of has, right? But I mean, what you're getting at is the freedom. And yeah, I mean, I think like that, like, what are your goals? What are your purposes? What gives your life a sense of meaning? And another famous existentialist named Viktor Frankl always liked to say, like, the final freedom is the freedom that can't be taken away, is the freedom to adopt the attitude I want toward the circumstances I'm in. And he was talking about being in a concentration camp, right? I mean, he said, even in a concentration camp where you seem to have no freedom at all, you have a final freedom, which is the freedom to adopt the attitude you choose to the circumstances you kind of helplessly find yourself in. And he's talking about the same kind of existential piece, that there's unfinished piece that we all of us contribute to.
It's amazing that these themes continue to come up in therapy rooms.
Yeah.
Well, and I don't want to spoiler alert, but when Nietzsche wept, one of the parts where I just read was, this woman says, "Who are you to tell me about freedom?" Right? I moved from my dad's home to your home. I was not able to go to school. Right? So there is also these constraints that vary from person to person, and there's feminism and recognition that power imbalances are present, and that on some level we have some choice to choose possibly how we think, how we approach our current situation. So both of those tensions can be in the therapy room.
But I think it also goes back to, given our situation, the perspective that we take, right? So even as you are describing to somebody your situation, can that person empathize and put themselves in your shoes to truly understand that?
Yeah. And you know what? I mean, I haven't talked much about Carl Rogers. I've talked a little bit more about Maslow, but I mean, Rogers strongly believed that relationship is the core of everything. I mean, he was also an individualist, but he basically thought the core of therapy was developing a certain kind of relationship between the therapist and the client. And the absolute core of that, was prizing the client. I mean, creating that unconditional positive regard, that welcoming, but also that accurate empathy, that I am trying to enter into what he called the internal frame of reference of the client. And that's what I think you're talking a bit about, Andrew, is that is that effort that somebody, when you're in therapy, that somebody is taking the time and the trouble to really attend to that inner world of feeling and experience and trying to help you put it into words to symbolize it and to accurately reflect it back to you and to help you decide where to take it, what to do with it, right? To follow you and track you as you're making choices, right?
I'm actually just kind of conscious of the time, and I know, Bill, we could listen for hours, and I'm wondering, in terms of the humanistic approach, and what are some of the other elements that listeners would benefit from hearing about in terms of, maybe the history, but maybe also its current kind of how it shows up presently in therapy?
I think it still shows up in, you know what? It shows up in every therapy. Like these big existential themes, they rear their heads all over the place in therapy, right? People are still trying to, cope with their suffering and grow through their suffering and express their world to another person and wrestle with anxiety and death and pain and so on and so forth, right? But I mean, like Rogerian person-centered therapy is very much alive and well. It's still
Hmm.
practiced by a lot of therapists, maybe even more in Europe than in North America. And there are other approaches that are alive and well, but the one I know best and that Kendall talked to you about was emotion focused, right?
Hmm.
And emotion focused therapy, I mean, has all of these humanistic pieces, right? I mean, it really does. It does look at, I mean, it prioritizes emotion, but it prioritizes emotion within a holistic view of the human person, right? Of the client and what they're struggling with and the choices they're making and all these big existential themes. And one of the main questions that you have in your mind as an EFT therapist is what is this person's chronic enduring pain? Like that we all carry this pain within us, right? And we feel it, we feel it bodily, we feel it emotionally. We have this load that we're wrestling with and emotion focused therapy helps to try to unpack that from kind of an inchoate large pain to like, well, what is it, right? Is it that I feel abandoned and I have trouble with relationships? I'm always feeling distant and isolated from others. I'm feeling left out by others. Am I feeling hopeless? Am I feeling helpless? Am I feeling shame? One of
Yeah.
the big things that you see over and over and over again in therapy is shame and
Yes.
the burden of shame that people carry and how they try to deal with it and underneath substance abuse, underneath eating disorders, underneath chronic depression, there's usually so much shame and a sense that there's something profoundly fundamentally wrong with me. So yeah, no, EFT, I would say EFT is emotion focused therapy is a very emotions are from an evolutionary point of view, might as Kendall said, right? They're much older than cognitions, and they guide action, and it's a form of information processing that we need to attend to and need to help clients to attend to. That's one of the main ways that humanistic therapy is still with us.
I think anyone starting therapy, like this is one of those episodes that we've done, like one of the few where I would say if you're starting therapy, you really need to listen to this because when someone starts therapy, they might be thinking, you're going to give me advice, right? Give me advice on how to get through these tough times. But it's so much more than that. If in fact, some would argue that it's not even about advice giving at all, right? It's about understanding the self. And this is one of those conversations, like if you're going to start therapy, like understand what therapy is truly and deeply about.
Yeah. Whatever you think about good and evil and all of that stuff, these are big, big topics that, would be worth a show in themselves at least. But I mean, Carl Rogers said, and I think there's some big amount of truth to it, that the fundamental stance of a therapist needs to be trust. And trust in somebody's capacity as a person to grow and develop. Like, I am going to provide the relational conditions that help you to do that. And then I'm going to accompany you and support you as you kind of become more and more aware of what it is you're feeling, what it is you're wanting, and what's getting in the way. And so it's not there's very little of therapy that's about advice giving. I mean, that would be
Yeah.
a tiny part of therapy. It's journeying with somebody. I mean, from a humanistic point of view, it's journeying with somebody as they become
Yeah.
a changed and new person, as they grow.
And how many times have we said, how important therapeutic relationship or therapeutic rapport is? And I think it was actually one of your lectures, Bill, back in our practicum course. I think you showed an article on how important therapeutic relationship is and that trust in order for any change to occur.
Yeah, no, in psychotherapy research, it's called the working alliance. And it's absolutely central to outcome in therapy, right? Like, it's developing a positive working alliance, right? It's all about that relationship, right?
Yeah, and I think all three of us are probably pretty closely aligned in terms of our view of therapy and what is, you know, helpful and what are the mechanisms of change, if you want to say it like that, like for positive outcomes when we look at research. But I'll say like you said, there's different schools, and so that's what makes psychology, or at least applied psychology, unique in a lot of ways in terms of even a profession. We don't just learn one way. And, I remember working with a young man, and, he was quite focused on the cognitive aspects of making choices and, in a way, attempting to control emotions, not seeing emotions as a source of information, but as like something that needs to be managed. And I'm like, well, I'm probably not the right therapist for you, right? Like if that is the approach that you are looking to achieve your own self-actualization. So there are many different approaches, and if anyone is resonating with this, like there are, like you said, emotion focused or even any like experiential
Yeah, right.
psychotherapies, right? That really focus on the relationship and the power of the positive impact of a relationship can have. Sorry, I'm getting on a soapbox.
Yeah, yeah. No, all experiential approaches to therapy are basically, I shouldn't say all, but most experiential approaches to therapy are basically kind of in that humanistic family, right? It's interesting, now there's more and more overlap between the big theories, right? So in the third generation of cognitive behavioral therapies, they do talk a lot about experiencing but yeah.
Well, just conscious of time, I think we can go on and on. And, Bill, you brought up so many names that, that I have forgotten. But once you said it, it's like bringing me back to, your classes on the history of psychology, Heidegger, Tolstoy, like you mentioned all of these. I remember back, I don't even 15 years ago, maybe now, I don't even know. But no, it was a pleasure having you on, Bill. Again, going back to the foundations of psychology, I think this is one of those reminders of where we're from, and that a lot of the stuff that we do on a practical level is rooted in something that is bigger than us and bigger than our practice. It's huge, and it's something that we can continue exploring.
Yeah, like what does it mean to be a human being, right? What does it mean to be a person, and how do people function, right? And I mean, that's going to involve literature, philosophy, religion as much as psychology, right?
We talked about all the positive things and the positive influence that Bill has had on us personally. One of the downsides is that every time I ended up listening to him, I'm purchasing a new book. So I literally just bought two audiobooks as we were doing this. And so there's more to learn, there's more to explore. And I think in grad studies, there's so many books and there's so much information that you have to pick and choose. So this was a nice kind of refresher. And it's like, oh yeah, I want to get back to some of that early literature. And
Yes.
we can return to it over and over again with our experience in life. And even I'm thinking about in the therapy room, my experience that I had, I have now that I didn't have when we were in '09, right? So
Yeah.
this has been such a treat, Bill. I really appreciate you taking the time to chat with us and to re-educate us again in terms of the history.
It's been a treat for me too. It's been a pleasure. And like I say, there's nothing more gratifying for a teacher than to see students who go on out there to be tremendous psychologists, right? And to succeed so well. And yeah, it's been a pleasure to be on your podcast.
Thank you, Bill. I was actually going to add, you mentioned so many names of authors and books and philosophers. You need to write something someday.
Yeah, no, I should. Maybe, I'm approaching retirement, so maybe I'll write more in retirement.
Perfect, Bill. Thank you so much again, and it was a pleasure.
Thank you. You're very welcome.
Take care, everyone. If you like this, hit subscribe, whatever else that you need to do to spread the word about this podcast. If you find it helpful, share it with those in your life. And hopefully this helps reflect on what it means to be human and how to be human together and treat each other well and take good care of each other and ourselves. So until next week, take care.
Take care, everyone.
Take care.